And for us it was very much about trying to meet the needs of our community and our carers, and explore very much what they needed in the way of a crisis provision, not what traditional services had been built around in the way of crisis response. And we did everything we could to move away from a clinical model as such and move much more towards looking and focusing on people's needs, using principles around hope, control and opportunity, and thinking much more about what we could do in a very short, focused passage of interaction with people.
I think the house, it was started from gathering some service user feedback, looking at what sort of gaps are out there in regards to supporting people, giving people a different opportunity.
To admission, yeah, definitely to acute admission.
And listening to people that had experienced hospital admissions or support at home, they wanted sort of more opportunities really, didn't they?
Yes,
they wanted another opportunity, but they had more control and more choice really of what happened with that journey, I suppose, really.
Yeah.
As soon as I came across that threshold, I was supposed to feel very, very comfortable. My anxiety levels just came straight down.
It's home from home, it's not clinical, it's support staff, there's no nurses, there's no ward rounds.
But coming here and having my own space, still being able to go out if I wanted to, and I actually went down the shops with a member of staff, and it was just so different to everything else because I didn't feel like I was being locked away.
And it's a much more relaxed environment, the house to an acute admission, and we can work much more collaboratively with service users. They have a massive say in their care and treatment while they're with us. And that really works well because it gives them that control back, as you say.
And the times I've stayed here, I've made Sunday dinner for everyone who's wanted to join in, and at dinner time when we sat down in the dining room all together with staff, and it was just like Sunday dinner at home, and that's what they wanted it to be like, is home from home.
Everybody fought my corner here, so it was very much, we'll make sure that you get the help, you're not going to be on your own anymore. And I think that was a really significant turning point for me, is that actually you're not alone, and I didn't need to be scared anymore, and I didn't have to worry about who I was talking to and whether I could trust them. Everybody is so professional but so caring at the same time.
And you end up with a really calm, quiet house that's built around that engagement, around peer support between users, about volunteers coming back in when they've used the environment to access services again. And it gives something that acute admission can't give in that respect, but allows people to feel listened to and validated really early on in their care.
And luckily, because of the help here, I've now been accepted by teams where I'm going to get the proper treatment for my EUPD. I'm seeing psychiatrists, I've made access to different medication, which has been life-changing. And I'm back on track. I'm at home, I don't feel alone anymore. I come here probably once a week to talk to staff, and people ask me how I am. And now it's not, I feel anxious or I don't want to carry on. Now it's, I'm really excited, I'd really like to do this. And everybody's so supportive of that.
As this chap, I'm sure he won't mind me saying, he came to the Warren about 3 times in crisis, got a lot out of the Warren, got a lot out of offering that peer support, and from that developed into volunteering here.
Yes.
And then from that actually became a HCA, and is currently still working as a HCA. So, you know, it's just one story, but something that sticks in my mind.
Many stories like that, isn't there, where the service users, residents have gone on to do volunteering roles to actually help support people with similar difficulties to their own, which is invaluable support.
Getting well again, I'm back into a volunteering role, But if it wasn't for the mindfulness of everybody who works there, and at mine too, then I wouldn't be here.
Yeah, so the Crisis Cafe's really developed from the work that we'd done in the Crisis House. We kind of recognised that we were able to manage working alongside service users in this collaborative way without undue risk and without undue concern. And actually, the earlier you work with a service user and the carers, the better the outcomes and the more options you have. And we wanted to look at how we replicated that in the community, but worked with our third sector partners, the people in the community that are doing these kind of lower levels interventions all the time really, and working in this way. So we approached Mind and the third sector as charitable organisations and asked them specifically what would it look like if we generated some hubs and some environments where people could come and self-refer when they're in a mental health crisis, and they would get support and engagement and listening, and how would NHFT support that and make sure that Mind felt safe with it and felt that it was a good working option.
So I've seen the Crisis Cafe and how it's benefited our community and how it's benefited those people that have attended. It provides that safe space for people that are feeling that they're unable to cope at home, and that's something that's actually quite priceless for them. It provides somewhere that's welcoming, that's comforting, that is relaxed as well, that offers that non-clinical environment, but then provides that important support that they do need at that time.
Knowing the option is there, that's a big deal to me, because before I just felt like really on my own, and I know the fact is I could come down with anyone in my family if they needed it as well. It's not like you don't have to obviously be a service user of Mind to use it.
That's it.
And I think that's the brilliant part.
It's used as a walk-in service. Anybody, you don't have to be a previous service user to attend the Crisis Cafe, which is a good thing, isn't it? And I think sometimes that's enough, isn't it? Although not everyone might not attend a Crisis Cafe, but just knowing that support is out there for people is sometimes enough for people to know there's a safe place for them to go, isn't it, if they don't need
I mean, I've recommended it to tons of people.
When you're really in a crisis, and then to come through a door where within a few seconds it changes, I suppose you could say. The feeling of that suicidal tendencies reduces. I suppose that's, it's one of the nicest things to happen.
Without going to the Crisis Cafe, I wouldn't have found the Warren, and without finding the Warren, I wouldn't be having all these amazing things happen to me now. So yeah, it was definitely the first stepping stone for me in my journey.
I used to dread waking up the next day, but now I look forward to the next day, next week, next few months, next year. So now I'm looking in the future. I cannot look in the past. I'm not going that way.